Doctors and public health officials have been sounding the alarm about a third wave of COVID-19 in several provinces and calling for immediate political action, forcing some premiers to respond this week.
I'm the one who has to make the tough decisions. Today, I need to make one of those tough decisions. Ontario will pull the emergency brake for the entire province.
We must act quickly. This is why I'm announcing that Quebec, Lévis, and Gatineau will be on pause for 10 days until April 12.
But not all agree with more restrictions, at least not right now.
Compliance with the measures matters far, far more than the stringency of them.
So have provinces waited too long to shut things down? How does this political response to this surge, the third wave, compare to the last two? It's Thursday. I'm here with At Issue, Chantal Hébert, Andrew Coyne, and Althea Raj. Good to see you all. Sort of bleak that we're back here talking about something that we've talked about many times before, but we are. And so let's start there, Andrew. Why are we here again at a time when, politically and from a public health perspective, we should probably know better?
Well, I think the first thing to note, and it's not to excuse anybody, but it is context, is things are tough all over. Famously well-run places like Germany, where their test and tracing program was legendary, are now grappling with another breakout as well. So it's a complicated problem, first off. We don't have all the answers, and data is very patchy, et cetera. That being said, we also know that we had success after the first and second waves when we put the hammer down, when we brought in, I'm talking about Ontario, but I'm sure the experience can be generalized, when we brought in tough lockdowns. And what happened in both cases, particularly in the second one, was once they got the virus down, they let it back up off the floor. They relaxed the controls too soon. And we're too late now to put them back on. Now, I understand the pressures they're under. I mean, before this decision was made in Ontario, I understand the meeting of the cabinet went till midnight. So there are political pressures. There are businesses and industries coming to them saying, you can't do this to us. But ultimately, this is not a choice, as I've said before, between the economy and health. It's between the short term and the long. If you don't get control of the virus, then you're not going to be able to open up the economy either.
And I think you're totally right. I mean, those two things, it's not an either or, but it seems to be an either or for some premiers and some areas, Althea.
Yes and no. I don't know if it's an either or. I think it's like, what is acceptable? What's the level of risk that they're willing to accept, and what do they think the population is likely to accept? And that's why I think we have a hodgepodge of measures from across the country. I agree entirely with what Andrew has said. I think the reason that we find ourselves in this mess is because we never managed to clamp down on the second wave properly. Just even last week, Premier Ford was announcing that in Toronto, you'd finally be able to get a haircut in the second week of April. And obviously, a week later, things have changed so much that that things have to be shut down. But the measures are like half measures. And I think that has left people feeling confused, distrustful of the government, questioning the government's actions. Like in Ottawa, I can no longer go to the hair salon, but I can still go shopping for a pair of jeans, let's say. Like, how does that make sense? But you can't eat with your own family in a patio on a lot of things I think don't make a lot of sense to a lot of people. And I can understand why, especially the business community, the small business community, is incredibly frustrated. And I think the question needs to be asked, like, would it have been better to follow like an Australia type model where you really lock things down for a significant period of time and to try to get rid of this thing, as opposed to just kind of like prolonging the pain? And then of course there are questions about where we should be vaccinating, where we should be doing on-site testing. I think there's lots of questions to be asked about the way the provinces have responded. Okay, Chantal, your turn.
Yes, and practice doesn't make perfect when you're thrown curveballs. And I think in this case, the provinces, even those that did manage to do a fairly efficient vaccine deployment, what they did not see coming was not just the variants, but the fact that the variants would make younger people sicker. And that's a curveball that 2 weeks ago wasn't on the radar, or even a week ago. and that has changed the picture. It has been interesting to see that, for instance, in my province, the places that are now under tougher measures were places where there were more things that you could do, as opposed to Montreal, where most of the stuff that was shut down was never reopened again. I'm always wary of going after premiers for curveballs that no one saw coming. And I don't think that we should get into the debate over who gets vaccinated and who doesn't. But I will note that even as cases are rising in Quebec, where the choice was, as in many other places, to start with older people, there are no new cases and no new waves of cases in long-term care homes.
Right.
So there, I mean, somewhere, somehow, we're in a race between vaccines and variants. We're not necessarily winning that race, but we're not yet completely losing it.
Yeah, yeah, go ahead, Andrew, yeah.
I was just going to say, there's so many moving parts, including, human beings. So take the vaccination, for example. I've been seeing pictures of, giant mass vaccination centers that are basically empty. Is that the fault of the organizers of them? No, it turns out that people are kind of skittish about going to these large centers, and they prefer going to places like pharmacies that are more human scale. That's something you probably, can't be sure of and can't predict until you try it.
I mean, I think it's fair that to say that this third wave is different than the first two, right, for all the reasons that Chantal laid out there. But I do wonder around, and again, we've talked about this time and again before, but the communication around where things are at and some of the things that Althea suggested there around the mixed messaging about what you're allowed to do and why it applies to some and not others. I mean, is that not something, maybe you can start on that, Andrew, is that not something that we should be better at this stage?
Well, it's easy to say yes. Again, I think if you think about some of the pressures they're under, where some people are saying you're doing too much and some people are saying you're doing too little. Now, obviously, it's your job as a government to find that right balance. But I think you see in some of the kind of performative things that they've been doing that they're trying to show how tough they're being, even as they're perhaps not being tough enough in other areas. So I'm not aware of a great deal of cases that have come out of outdoor patios. And yet I think they probably felt if we're saying we're shutting down and we're leaving outdoor patios out, we're going to take stick from the media. So part of the messaging, I think, is and the confusion, the messaging is the pressures they're under because, as I say, there are people shooting at them from both sides on this one.
Yeah, and maybe go ahead, Chantal, yeah.
And if I can add, I'm not totally sure, and I know that I'm taking a shot at ourselves, that the army of armchair critics who come out whenever there's an announcement is terribly helpful.
Yeah, I mean, you're probably right, and I mean the complexity of what they're dealing with, I don't think should be understated, Althea. But it is also not a complexity that is new to them, I guess is where I'm at with this, and that's why I question where the decision making is and why it is still so difficult to have that push and pull between them, Althea.
I'm not sure that it's not new to them because I'm shocked. And I will say, like, none of us obviously are like medical experts. Yeah. But listening to the medical experts, like just last week, the chief medical officer in Quebec was saying like, oh, like the data suggests that we don't have anything to worry about at this point. And, a few days later, actually, we do need to worry about, at least in some parts of the province, they really did need to worry. I think generally speaking, the provinces actually have done a good job. Even today in Ontario, in Alberta, this evening with Jason Kenney, of laying out why the government is taking the action that it is taking by laying out the data, by explaining what the case counts look like, what the ICU numbers are, why the government is being pushed to take more stringent measures. I think that is helpful. I think where it's where the things are disconnected in people's minds are when the science seems to suggest you should be taking action that is a lot stronger than the action that the government actually takes.
Chantal.
Yes, but political leaders have to balance a lot of interests. Science maybe at some points would have suggested that no kid should be in school in person. But there are a lot of other factors that make it possibly a better thing to take the risk to have the kids in school in person. So to sit in the premier's or the prime minister's chair is to have to balance a whole lot of issues. It's easy enough to say we're going to send everybody home, and if you're a medical expert, your best advice would probably be put everyone in a bubble and everything will be fine, except we're all going to go crazy.
Okay, let's move on to another topic. This week, the Parliamentary Budget Officer said the economy is maybe doing better than expected. A predicted $363 billion deficit is looming, but he also had some warnings about the Liberals' stimulus spending. All this just weeks ahead of the first federal budget in 2 years. Chantal, Andrew, and Althea all back for another round of At Issue. There were interesting things in that report. I'll start with you, Andrew, on this, because it did show that some of this money that we're throwing out the window in huge quantities will stop, and we will start to pull our way out of deficit. I know you'll probably want to talk about debt, but there will be some of that will happen. But there were some interesting warnings, too, about the amount of stimulus spending.
Yeah, the good news is the economy's come in a little stronger than maybe we might have expected, and the deficit's probably going to come in a little lower than it been projected a few months ago. That's good news in one sense. It's bad news in another way for the government, because I think they want to spend the stimulus money anyway. I think stimulus was just a label they wanted to put on it. And people have been telling them now from all kinds of corners, even if you think this fiscal stimulus would be effective, and I'll we'll leave that argument to one side for now, it's not necessary. The economy is going to be pretty much back to full employment by the time they start to wheel it out. And the risk, of course, is you contribute to things that are also already stirring in the United States and elsewhere, of interest rates starting to rise. And remember, the whole argument that we can run these enormous deficits was interest rates are at historic lows and are going to stay there. Well, they're already about twice what the levels that they were projected to be in the November statement. So we've got to be very concerned about that. So yes, I think this is a warning that says, the deficits are supposed to be temporary. They're supposed to be keyed to the immediate crisis. We do not want to get into long-term structural deficits of this kind. And the risk, if they proceed with the stimulus, is that it's exactly what you get.
So is it that they shouldn't use stimulus, Chantal, or is it that politically it might be wiser to do something smaller than what they're talking about? Although we all know that this is likely a pre-electoral budget too, so they're stuck with that as well.
Well, they're stuck, but we're not, in the sense that the good news about all this is we don't know what the balance will be in the budget, but what we do know is that it is more than likely that Canadians will have a chance to pronounce on it in an election before most of the stimulus money or whatever money is spent. So the government will have to make a case for its choices, and people will not have to wait 3 years to say this was the wrong choice or this was the right choice. I think, bottom line, it's a rather healthy situation.
You know what just happened there? Chantal got really close to predicting an election. That like as close as Chantal is ever going to get.
In 2021, I'm not a June election person.
Okay.
Just so we're clear.
Okay, that's fine. Althea, what did you make of the report and what that should tell us about what to expect?
Well, I think Chantal's right on the timing there. It is very clear that the Liberals wanted to go to run on this stimulus and to use the opportunity to ask people to buy into their plan for recovery. That might still be the case if the election is at the end of the summer or later in the fall. But I think that the third wave has caused unfortunate rethinking in Liberal circles, at least according to their own idea. The PBO report is really interesting. There are just a few things I like to say. We were already in a structural deficit before the pandemic hit. So I think the flag about that 70 to 100 billion, including program spending that might continue to run extra deficit, is something that is concerning. I wonder if Chrystia Freeland regrets putting those fiscal guardrails that were suggested to her back in the fall, because as Andrew so clearly pointed, judging by the economic numbers, the unemployment numbers, things are rosier. And basically the PBO is saying, I don't think there's a need for this. There likely may not be a need for this at all, certainly not to the amount that you're expecting. But I also think that the pressure looking down south and seeing what Joe Biden is doing, there will be a Build Back Better envious. Perhaps they will want envy from what they're doing in the U.S. and what the Liberals would like to do here. So whether or not it is needed, I think we are going to see at least a large chunk of that money.
Well, that makes sort of an interesting place for the Conservatives too, and you can throw in your election talk here too, Andrew, because then the Conservatives can they not start to make the case about big spending Liberals, pulling us deeper and deeper into deficit, or is that not something Canadians are thinking about right now? Andrew, and then Chantal clearly has something to say.
I think they've got a fine line to walk. They would be remiss if they were not making a case for some degree of restraint, because the Liberals are certainly unrestrained, it seems to me, by any sense of the debt and that kind of thing. I think what the Tories need to work through is some version of what I might call small government activism. And I use small in relative terms. But they've got to show that they have policies and ideas that are addressing what is clearly a public mood for a more active government that's more focused on really solving some of these problems. But they've got to show that they can do it in ways that are different from the Liberals and ideally are lower spending and lower taxing than the Liberals. So it's not just, no, don't do that. It's do this instead. And that's what I think they really need to work on.
Okay, last word to Chantal on that.
Well, if the election were 3 years from now, yes. But if you read the audience that Erin O'Toole is going to be speaking to, most likely in an election, which will most likely come a lot earlier than that, I agree with Andrew. They are going to have to walk a really fine line, because at this point, the audience is not in the mood to be told they're big spenders and we're not, because all that the audience will hear is austerity and cuts.
Yeah. Althea, I have like 20 seconds for you to respond to that too.
I don't know if they're going to hear austerity. I mean, the only time frame that Erin O'Toole has given himself is reducing the deficit in 10 years. I think he's really cautious about being painted with that brush.
Okay, this is good. This sets us up for some good pre-budget talk in a couple of weeks, and on the night of the budget when it finally happens. 2 years we've been missing these budget conversations. Thank you all very much. Appreciate it.